So we're going to look at circulation, and this is a really neat picture because this is what happens everywhere in the body. You will notice that you have blood vessels which leave the heart, and those blood vessels which leave the heart are known as arteries, and blood vessels which return to the heart are known as veins. And I also want you to look at this picture and see that arteries tend to get smaller and smaller as they branch out. Can you notice that? So they get smaller. So we say that they have branches. Veins, on the other hand, they begin small. Can you see that? So they begin small. They get larger and form larger veins. So for veins, instead of saying branches, the word we use is that a vein drains, a small vein drains into a larger vein. Or we say the larger vein has tributaries, and its tributaries will be the smaller veins. Okay? And what you'll notice also is as the arteries get smaller and smaller, they break up into capillaries up here. These are all capillaries. And then the capillaries join, and at the venous end, then they form small veins which will get larger and larger and form the two main large veins, superior and inferior vena cava. And I just want to also check whether... So let's just look at this short video on circulation.
The circulatory system, consisting of the heart, arteries, capillaries, and veins, is the pumping mechanism that transports blood throughout the body. In the heart, the left ventricle contracts, pushing red blood cells into the aorta, the body's largest artery. From here, blood moves through a series of increasingly smaller arteries until it reaches a capillary, the junction between arteries and veins. Here, oxygen molecules detach from the red blood cells and slip across the capillary wall into body tissue. Now deoxygenated, blood begins its return to the heart. It passes through increasingly larger veins to eventually reach the right atrium. It enters the right ventricle, which pumps it through the pulmonary arteries into the lungs to pick up more oxygen. Oxygenated, blood re-enters the left atrium, moves into the left ventricle, and the blood's journey begins again.
So let's first look at blood vessel histology and see how this helps transport the blood and, out of the heart and to come back into the heart. So when you look at blood vessel histology, there are three main layers. Tunica intima, intima for intimate, is the innermost layer. And it's a very, very thin layer. It is made up of simple squamous epithelium, which you can see on, this is an artery, this is a vein. The cavity is known as the lumen. And lining this cavity, you can see the simple squamous epithelium, which in blood vessels is known as endothelium. Below that is a little bit of connective tissue, which is called the subendothelial layer. And then there is again some connective tissue, which is called the internal elastic membrane or lamina. But what I really want you to know is that the endothelial lining is very thin and it's simple squamous in nature. The next layer, the middle layer, is called tunica media. So media, middle. It's made up of smooth muscle and in elastic arteries, which are the large arteries which come off from the heart and the first few branches. There are some elastic fibers in it. Others have only the smooth muscle and very little elastic fibers. And then again, there is another membrane or lamina, which is called the external elastic membrane. But for your purposes, I would like you to remember that tunica media is the one which contains smooth muscle, and this smooth muscle has a sympathetic innervation. So the sympathetic nervous system innervates this smooth muscle. Parasympathetic nervous system does not innervate blood vessels, smooth muscle in almost most parts of the body. Very, very very, very small areas in the body have parasympathetic, but for most part, it's all sympathetic innervation, blood vessels. And then the last, the outer layer is called tunica externa, or also known as tunica adventitia. And this is made up of connective tissue with a lot of collagen fibers, so it lends support on the outside. So arteries and veins both have these three layers. And when I say veins, I'm talking about medium-sized and large veins. Smaller veins, the wall thickness will be a little less. But what's the difference between the two? In the arteries, if you look, you can see that the tunica media is a very thick layer. It's the thickest layer. So the tunica media is much thicker in the arteries. Veins have a thicker tunica externa or adventitia because you don't want the veins to collapse. So you need some protection from the outside. Because of this thick muscle layer, arteries also tend to have a circular lumen. Veins tend to be a little bit more irregular or flattened, as you can see here. And as the arteries get smaller and smaller, they form branches. And, the arteries are then known as arterioles. So you have a huge artery called an elastic artery, which is the big arteries which come off from the heart and the major branches. So, for example, the aorta is an elastic artery. And there's a part of the aorta called the arch of the aorta. And its branches are also elastic arteries. So they're very close to the heart. They're very large. They have a lot of elastic fibers. And how it helps them is that the arteries, when they fill with blood, they expand. And then they recoil because of the elastic fibers. So they help to push the blood forward. So they keep making sure there's a continuous flow of blood. And that feeling that you get when you take the pulse, you can feel that. That is because of this filling and recoil. So it kind of sends that pulse or wave forwards. Okay. After that, all the major branches are what are called muscular arteries. So there, the elastic fibers are much fewer in the tunica media. It's more just smooth muscle. Muscular arteries become arterioles, where you can see they are much smaller. Again, a smooth muscle layer is thick. Sympathetic innervation in the arteriole is really important because this, at the arteriolar level, is where arteries can constrict and dilate, and that's where it makes a difference. So constriction, called vasoconstriction or vasodilation, is more important at the arteriolar level because this is where it really makes a difference. In an elastic and a muscular artery, they can also constrict and dilate, but they do not do so as much. So they don't have that much of an effect in the blood flow to the body. It's at the arteriolar level because a small amount of constriction can cause less blood to flow to an organ. When the blood vessel dilates, then blood flow to the organ will be, much more. Okay, so it's at the arteriolar level that vasoconstriction and dilation become important. And then we go to the capillary, which you can see here. So in the capillary, if you notice, you have in the capillary here, you have only tunica intima. You do not have media, you do not have externa, because at the capillary level is where exchange of gases is going to take place. So you do not want thick wall to be there because you want gases to be able to diffuse easily. So you can see here that only tunica intima is present in the capillary. Then when you get to the capillary becoming a small venule, you can see some smooth muscle fibers will come, and then, it will form a vein where, again, you will have a tunica media, but the adventitia is the more important part. Okay. Now, wherever blood vessels meet each other, we call that an anastomosis. Arterial anastomoses are very common in the brain, in the GI tract, in the palms and soles of your hands and feet where you form arches, and certain other parts of the body. You have arteriolar anastomosis. Even, for example, coronary circulation, right on the surface, there is a bit of anastomosis that goes on. Venous anastomosis is more common. Veins tend to they don't have a very definite pattern, so they tend to anastomose a little bit more freely than arteries. But what anastomosis just means is where they meet, and so blood can flow in, from one to the other. So it helps, because if one is blocked, you can kind of reroute the blood supply. So now here let's look at circulation. So in any type of circulation, you always have an arterial component to it and you have a venous component to it. So in systemic circulation, this is the blood supply to the body. And you exclude the lungs here. So it has an arterial part, which is the aorta with all its branches. So here's the aorta, so all its branches going to the head and neck or to the body below the neck. And then the venous part will be how the blood is returned to the heart. So this is finally brought in through the vena cava. So the inferior vena cava from below and the superior vena cava from above. So the major blood vessels, if you think about it, you can say the aorta and its branches and the vena cava and their tributaries are the systemic part of the circulation. Then we have pulmonary circulation, which is circulation to and from the lungs. So to the lungs would be through the pulmonary artery, then it goes into the lungs, and pulmonary veins bring the blood back into the right atrium and into the left atrium, into the left atrium, and then from there it goes into the left ventricle, and then the systemic starts. So you can see that they are kind of related to each other. It's not that each one functions on its own. Unless you have pulmonary circulation bringing back oxygenated blood, the aorta can't do its job, because it's not going to be able to take all this oxygenated blood to the whole body. So they work hand in hand with each other, but we call it separately: pulmonary going to and from the lungs, and systemic to and from the body. And then we have fetal circulation, which is different, where you have an additional some additional blood vessels, and you have some additional pathways which will close off once the fetus is born. And what you will see is that in the pulmonary circulation, remember, the artery is deoxygenated, carrying deoxygenated blood, whereas the veins carry oxygenated blood. In the fetal circulation also, we have arteries called umbilical arteries, which are just like pulmonary. So they also carry deoxygenated, and umbilical veins carry oxygenated. So these are the two exceptions, but otherwise, everywhere in the body, arteries carry oxygenated blood and veins carry deoxygenated blood. So here, let's look at pulmonary circulation. I just told you. So beginning here, when the right ventricle contracts, sends deoxygenated blood into the pulmonary artery. This part is also called the pulmonary trunk. And it divides into right and left pulmonary arteries, which then break up into smaller and smaller branches, and they finally break up into pulmonary capillaries in the lungs, where gas exchange takes place. So they give up the carbon dioxide to the alveoli, and they take in oxygen from the alveoli, and then the venous end of the capillary starts, which joins up and forms pulmonary veins. So you have two on either side, and they bring blood back into the left atrium. So this is pulmonary circulation. And the difference from systemic is that the arteries carry deoxygenated and the veins carry oxygenated blood. Plus also, because they don't have very far to go, the tunica media in the artery is not as thick as it is in the aorta, because the distance is not as much. So the arterial wall is not as thick. Okay. So let's look at systemic circulation. And here's kind of a general breakdown. So if you look at veins, if we look at the veins up here on the venous side, and we'll do the arteries later. So here, let's see the venous side. From the head and neck area, you can see all of these veins are finally going to drain into the superior vena cava, and the blood will enter the right atrium. In the thoracic area, this part here is the thoracic area. This here is the thoracic area. You have a system which is called the azygous system. So you can see this azygous system over here. It actually connects, if you notice, here's the superior, here's the inferior vena cava. It actually connects the superior and inferior vena cava here. So it drains all of the thoracic structures and then opens into the superior vena cava, and then it goes into the right atrium. And then we have separate in the coronary circulation. Remember the veins, the small, the middle cardiac, the great cardiac veins which open into the coronary sinus, and then separately the anterior cardiac veins and the venae cordis minimi. Remember, anterior go into right atrium. So they finally, most of the venous blood from the heart also enters the right atrium. Then in the abdominal area, which is this part here, in the abdominal area, you have a special system which is known as the hepatic portal system. So here in the abdominal area, this part here is called the hepatic portal system. So again, I'm talking about veins in this case. So you can see this, we are talking about veins. So just to give you an idea how we are going to break this up. So in the hepatic portal system takes all the blood from the GI tract, and instead of draining directly into the inferior vena cava, what it does is it goes to the liver. And you should understand why it does that. And if you pay attention here, if you look here, so in the gastrointestinal tract, what happens? You eat food, right? The food is broken down and digested, and all the nutrients are absorbed. Now, if they are absorbed into veins, if those veins went back directly into the inferior vena cava, and then they went, took that whole cycle, can you see that they would just be distributed equally through the whole body, isn't it? They would go through that whole cardiac cycle. The liver, on the other hand, is a very important organ because it knows what to do with all the nutrients you have eaten. It's important for carbohydrate, protein, fat metabolism, all the vitamins and all that. So if you had a way whereby you took all the blood from the GI tract, took it to the liver, pushed all the venous blood into the liver, so that liver first got it, did what it wanted with it, and then now it sent that venous blood back into the inferior vena cava and then went to the heart. So can you see that the liver first gets all this nutrient-rich blood, and then the deoxygenated part only now goes back into the right atrium, okay? So that's why you have the separate hepatic portal system, which you can see here. So it first goes to the liver. So somewhere here is the liver. So it will first go to the liver, give up all the nutrients there, and then the rest of the blood will flow through and get into the inferior vena cava, and then it reaches the right atrium of the heart. The rest of the abdomen, which means not the GI tract, but everywhere else, for all the other abdominal and pelvic organs, you have the blood going into the inferior vena cava, and then, the inferior vena cava goes into the right atrium. So these are the veins in the different parts in systemic circulation. Let's look at the arteries, and we'll begin with the aorta as it comes out from the left ventricle. Now here's one important thing you need to know when you talk about arterial branches. There's a definite hierarchy. It's like when you have, for example, you're on a highway, and let me say that this is US 19, okay? And you have big roads, major roads which come off. And let me say that this is Almerton. And what beyond Almerton? Bryan-Dairy, I think. And if you go here, there's another street which comes off. If somebody was to ask you, what does Almerton come off? You would say it comes off US 19, right? So you would say the branch of US 19 is Almerton, the branch of US 19 is Bryan-Dairy. And let me say this street is, I don't know, call it Belcher, okay? If I asked you, what does Belcher come off? You don't say Belcher comes off of 19, you say Belcher comes off of Almerton, right? So Belcher is a branch of Almerton, or Almerton's branch is Belcher. Do you see that? Same way, you have to maintain that kind of a hierarchy in the arteries too. So if you look here, let's start with the aorta, which is this part. So it has various parts to it, the aorta. There's the first part of the aorta is known as the ascending aorta. So this is the first part. It comes off of the left ventricle, and at about the sternal angle, we call it the aortic arch. And this aortic arch goes from it's kind of curved, as you can see, it's in an arch-like fashion. So it goes from anterior to posterior end. And so at the sternal angle, which cuts the disc between the fourth and the fifth thoracic vertebra posteriorly, this aortic arch begins here and it ends there. So you can see this is the arch we find. After this part is known as the descending thoracic aorta. And then when it passes through the diaphragm, we call it the abdominal aorta. So this is the third part and this is the fourth part. So these are the parts of the aorta, okay? So ascending, then aortic arch, descending thoracic aorta, and abdominal aorta. Let's look at the branches. So if you look here, you can see the ascending aorta. Its branches are the two coronary arteries, which we just did when we did the cardiovascular anatomy. The branches of the aortic arch, which you notice here, are these three branches, and these are also elastic. Remember, I told you the aorta is an elastic artery, as well as these major branches which come off from the aortic arch. So these three branches which come off from the aortic arch are the brachiocephalic trunk, the left common carotid, and the left subclavian. Do you notice? These are branches of the aortic arch. And if you look at this image here, you can see that the brachiocephalic trunk, notice the brachiocephalic trunk, it breaks up into right subclavian and right common carotid. Because here you have a left common carotid, left subclavian, so you obviously want a right one. So you can see the branches now of the brachiocephalic trunk would be right subclavian and right common carotid. Have you followed? And then each common carotid we will see will later, here you can see up here, each common carotid actually divides into an internal and an external carotid. So those will be branches of common carotid. Can you see that? So when you are asked which are the branches of aortic arch, it will only be these three. These two are not branches of the arch, they are branches of the brachiocephalic. Have you followed? Then when we come to the thoracic aorta, think of all the structures which are present in the thorax. You have the trachea, you have the bronchi, you have the esophagus, and remember we did, when we were doing the heart, we said it lay in an area called the mediastinum. We also have intercostal spaces present there. So here are some branches of the descending thoracic aorta. So we have bronchial arteries, mediastinal, going to the esophagus, the posterior intercostal, because the intercostal spaces, because the thorax is between, it's an area where you have intercostal spaces. So you can think of intercostal arteries, pericardial branches. So these are some important ones that I would like you to remember, okay? We have others like superior phrenic and subcostal. You can ignore these, but you can see this. Now this thoracic aorta then will just pass through the diaphragm and it will come into the abdominal region where we call it the abdominal aorta. So here is a little review for you. So you can see what are the branches of the ascending aorta, an arch of aorta. And here, if you notice under bullets, arch is this, this and this. Notice brachiocephalic has these two. Each common carotid and each subclavian will in turn have common branches then. For example, each common carotid will divide into an internal and external carotid. Major branches of both subclavian, right or left, include vertebral and internal thoracic. There are many more branches, but these are some important ones that I want you to remember. And here you can see the descending thoracic aorta, and here we will be looking at the abdominal aorta now. So let's look at the abdominal aorta. So before we look at the abdominal aorta, let's look at some important applications of some of these arteries we talked about. For example, the common carotid artery, and then we also talked about the subclavian artery. So here you're looking at the side view. So here is the aortic arch. So this part here is the aortic arch. This is the brachiocephalic trunk. This here is the brachiocephalic trunk. It's also called brachiocephalic artery or brachiocephalic trunk. And notice it's given off the right common carotid and right subclavian. This common carotid is dividing into an external carotid and an internal carotid. External remains on the outside. That's why it's called external. So you can see it's giving branches to supply a lot of the face. So there are some important branches which I've labeled for you. One is a facial artery which goes across, over the angle of your jaw. There's this artery which you can feel along your temple. You can, sometimes feel the pulsations. This is called superficial temporal. There's an artery which goes to the tongue, which is called lingual. So these are some branches of the external carotid. The internal carotid, it's called internal because it remains inside. It goes into the skull. So it gives no branches up here in the neck, but it will go inside the skull where we'll see it. Here's the subclavian. And one of the important arteries of the subclavian is this vertebral artery. VA stands for vertebral artery. And if you remember when you did ANP1, you remember the foramen transverse area of the cervical vertebrae. So it passes through the foramen transverse area of the cervical vertebrae, the upper 7. And it also enters the skull, okay, this vertebral artery. So we have this vertebral artery entering the skull, and we have this internal carotid artery entering the skull. They become important because when they enter the skull, they are going to supply the brain. So we say that there is something called the vertebrocarotid system. Vertebrocarotid system. You can see here vertebrocarotid system. And what you notice here is that the vertebral and the internal carotid arteries, they will meet and fuse in such an anastomose in such a manner that they form a circle on the ventral aspect of the brain, which is known as the circle of Willis. And the good thing about this circle is that if one part was blocked, blood can reroute itself. Okay? So just follow my cursor and just look at it over here. And let's see what happens. So here is the vertebral artery of one side. This is the vertebral artery of the other. So the two vertebral arteries, right and left, branches. The vertebral is a branch of subclavian. So from right and left subclavian, you got one vertebral artery each. Both enter the skull. And inside, on the ventral aspect of the brain, the two vertebral arteries fuse together to form an artery which is called the basilar artery. So this artery in the midline is called the basilar artery. This basilar artery divides, as you can see here, into two branches called posterior cerebral, right and left posterior cerebral. Okay? So we leave this part. So this is the vertebral part of it. Let's look at the internal carotid part. So here's right and left internal carotid. Each internal carotid gives off an anterior cerebral, which will go anteriorly, and a middle cerebral, which will go laterally. Okay, so here middle cerebral this way and an anterior cerebral that way. So we had the vertebral part and we have internal carotid. Now we just got to join them. So what happens is the two anterior cerebrals of each side, they join each other through, can you see this thin little branch here? And you don't need to know this for purposes of the test, but just to show you, this branch here is known as anterior communicating. So the two anterior cerebrals are now joined with one another, and this point where the middle cerebral is given off from the internal carotid, it joins the posterior cerebral. So there's one artery here and another one, and this one is called the posterior communicating. So can you see now that a circle has been formed? So you can see from the posterior cerebral, posterior communicating, middle cerebral, anterior communicating, anterior cerebral, middle cerebral, posterior communicating, posterior cerebral. Can you see this little circle present over here? This is called the circle of Willis. So if one vertebral artery were blocked, So blood would go through the other, and you can see it can go this way and come around this way. Can you see that? So any part, if there's a blockage, because of this circle, you can see that blood supply could be rerouted and would help to supply all parts of the brain. So this is one area where you can see this very nice anastomosis. So let's answer this question now. Which of the following is not a branch of the common carotid artery? Okay, the correct answer is number 5. Common carotid, the only branches of the common carotid were external and internal carotid. That's why it's called common carotid, right? The brachiocephalic is not a branch of the common carotid. The facial is a branch of the external carotid. Remember? So both these are not branches of the common carotid. So therefore answer 3 and 4 would be correct. Followed that? Okay? So we finished with the common carotid and it going inside. I also showed you something about the external carotid. Now let's look at the subclavian artery and a little bit of the some branches. We saw some over there, but you can see some other branches of here of the descending thoracic aorta. So here you can see the arch of the aorta. Here's the brachiocephalic. So here's the right common carotid, right subclavian. This subclavian artery at the outer border of the first rib. So up here at the outer border of the first rib. So I'm going to just say first rib. It just changes its name and it's called the axillary artery. So up to this point it's called subclavian. And there's a landmark, this first rib. At the outer border of the first rib, it becomes the axillary artery. This you can see it's continuing into the upper limb. The axillary is called axillary because it lies in the armpit or axilla. And then there again is another landmark. There's a muscle here called teres major, if you remember this. So at the lower border of teres major, this axillary changes its name and becomes brachial artery. The brachial artery then comes down, and at the neck of the radius, it divides, as you can see, into 2 branches. The radial on the lateral aspect, the ulnar artery on the medial aspect of the forearm. Notice both those arteries going into the palm where they join one another. So they form an arch here which is known as the palmar arch. So you have to remember this order. So blood flows from subclavian into axillary, from axillary into brachial, then into radial and ulnar and into the palmar arches. As these major arteries are traveling, you can see they give off branches on either side, and these are named branches which we won't worry about at this time. Okay? Then here I also want you to see, if you remember when I showed you thoracic aorta, we saw those intercostal arteries. So here you can see these are called posterior intercostals. These are branches of thoracic aorta. And just to show you the position, they are called intercostal because they lie between the ribs in the intercostal spaces. So you can see how they are lying along the inferior border of the rib. Okay? So it is just like, for example, if you were to give somebody directions and you say, take Alt 19, after a certain point, it's no longer called Alt 19, it's called Fort Harrison. And after a certain point, it's called Seminole Boulevard. So it's just a change of name, right? But you have to have the order right. So you can't say Alt 19 becomes Seminole and Seminole Boulevard becomes Fort Harrison. So you have to know the order. So here, let's answer this question. Blood flowing in the axillary artery would first continue into let me re-poll. Okay, let's re-poll the question. Yes, very good. Blood flowing in the axillary artery would first continue into the brachial artery. Remember, it's going downwards, away from the heart. So from subclavian into axillary, from axillary into brachial. Now let's go back to the aorta. So we saw the thoracic aorta and its branches. It passes through the diaphragm. So here's the diaphragm, this part here. There's an aperture in the diaphragm, and the thoracic aorta passes through it, and below the diaphragm it's known as the abdominal aorta. Now this abdominal aorta gives branches. If you look at this image here, it gives branches from the front, that means from its anterior aspect, and these are all branches which go to the gastrointestinal tract. And there are three main branches, and they are again in order. So the first branch that you see, which comes off just as soon as this thoracic becomes abdominal aorta, so the first branch of the abdominal aorta is this artery here, which is called the celiac trunk. So this arrow should really be pointing here. So we can... So here, this is the celiac trunk. This part here on top is the celiac trunk. And the celiac trunk it's some of its branches you can see here. It gives branches to the stomach, so those are called gastric. It gives branches to the liver, so those are called hepatic. It gives branches to the spleen, so that is called splenic. So this part here is the celiac trunk. This one here, so the arrow should be pointing here. So these are some important branches of the celiac trunk. The second artery that comes off, so this here is celiac trunk. So here is the cut end of celiac trunk, also called celiac axis. The second artery which comes off is called the superior mesenteric. So this one here is superior mesenteric, and the one below it is known as inferior mesenteric. So here you can see the branches that they are giving off to the rest of the gastrointestinal tract. The superior mesenteric gives off these branches to the small intestine called jejunal and ileal branches. So these go to the small intestine. Then it gives off colic branches to the colon. So the ascending colon and part of the transverse colon. So here are some colic branches. And then it stops giving off branches at about a junction between the right 2/3 and the left 1/3. So left 1/3 and right 2/3, that's where the superior mesenteric artery branches stop. From there on, the branches are given off by the inferior mesenteric. So inferior mesenteric also gives off colic branches to the left 1/3 of transverse colon, the descending colon, sigmoid colon. So you can see all of these branches. And also notice along the periphery, can you see that these arteries are anastomosing with one another? Can you see? So that there is a continuous arcade all along the border up here. So this, remember, if you remember, I said anastomosis was seen in the brain, in the palms and soles, and here in the GI tract. So you can see these arterial anastomosis here, okay? So this is very helpful because if there's a block somewhere, the blood can reroute and reach the areas that are not going to get their blood supply normally. So these were the arteries which came off from the front of the aorta. So that was celiac trunk, superior mesenteric, and inferior mesenteric, these three. Now let's look at the arteries which come off kind of from the side and they go to other organs. So these are not organs of the GI tract. So just by looking at the names, you can see the other branches of the abdominal aorta are the suprarenal going to the adrenal glands. These are the renal blood vessels to the kidney. These are called gonadal. That means they're going to the gonads. So in the male, we would call it testicular. In the female, we would call it ovarian. So we don't know the sex here. So they are called gonadal. Otherwise, in the male, you would call it testicular or ovarian if it is a female. And then the abdominal aorta divides into two common iliac arteries. So its final termination is the two common iliac, right and left. Just as we had common carotid dividing into external and internal, each common iliac in turn will divide into an internal iliac and an external iliac. The external iliac we'll see will go into the lower limb. The internal iliac goes to supply all the pelvic organs because it goes inside the pelvis. It will supply all the pelvic organs. The external iliac will supply the anterior part of the abdomen, and then we'll see it going into the lower limb. Just as how subclavian went into upper limb, here external iliac will go into lower limb. Okay? So here we can follow the external iliac. So here's the external iliac and here is the internal iliac. So remember, the internal iliac is supplying the pelvic organs. So external iliac below the inguinal ligament, this ligament here is called the inguinal ligament. So you always have to have a landmark where you can call it one artery and where it becomes another artery. So just below the inguinal ligament, external iliac changes its name and it becomes femoral artery. And here you can see these are the branches of the femoral artery. The femoral artery passes through a muscle. There's a aperture in a muscle called adductor magnus, if you remember it. So it passes through the adductor magnus muscle and goes to the back of the knee, where now, once it passes through that adductor magnus, it changes its name. From femoral, it becomes popliteal. So it's called popliteal artery. The popliteal artery then divides into two branches, anterior and posterior tibial. So anterior and posterior tibial. So this which is on the back is the posterior tibial. And this is just showing you the popliteal artery. And it's just showing you posterior tibial. Anterior tibial is this one, which you can't see further. So it divides into two, anterior and posterior tibial. Anterior tibial remains on the front of the leg. Posterior tibial will remain on the calf. And then notice how the posterior tibial goes into the sole. It divides into two branches and they form a plantar arch. So again, can you see an anastomosis? And similarly, this anterior tibial, it passes into the ankle. And beyond the two malleoli, the medial and lateral malleolus of the tibia and fibula, it changes its name and becomes dorsalis pedis. Pedis means foot, dorsalis means dorsum of the foot. So on the dorsum of the foot, the artery that you see is dorsalis pedis. So here you can see how femoral is becoming popliteal, which divides into two. Remember how brachial divided into radial and ulnar? They were lying side by side. Here they lie anterior and posterior. Anterior and posterior tibial. Anterior tibial continues as dorsalis pedis, so a bit of a change here. And only the posterior tibial forms the plantar arch, or its branches form the plantar arch. Okay? So if you got some question like this, blockage of the left common iliac artery will prevent blood from going to which regions? Okay, very good. Yes, because remember in the abdomen you had the abdominal aorta supplying most of it. The external iliac gives a few branches, but otherwise most of the abdomen is supplied by those. Yes, so left lower limb and left side of the pelvis. Now which organ won't the internal iliac supply? There's something common about these except one of them. Okay, remember internal iliac supplies all the organs in the pelvis, in the pelvic cavity. Your urinary bladder, rectum and uterus, they lie in the pelvic cavity. Remember hypogastric area when you did in ANP1? The stomach lies in the abdomen. So it is the abdominal aorta. Remember that gastric branch. So it will supply all these except the stomach. Okay, so it won't supply the stomach because that comes from the abdominal aorta. So whereas these are lying in the pelvis and therefore you have to call upon all of your ANP1 knowledge too. So now we form you saw the blood going all the way to the toes, and then now veins will start. So let's start with the veins of the head and neck. So you have these superficial veins. Most of the time veins follow the arterial names, but there are few exceptions, and here you will find there are some exceptions here. So there are some superficial veins which are present on the face area, so they don't form an external carotid vein or anything. What they do form is that you have veins called external jugular vein, and which lies on the outside. Here are some facial veins, and this is the superficial temporal vein. And then you also have the formation of another vein which is known as the internal jugular. So you can see these veins draining into the internal jugular, and also the veins from the brain, draining all of the brain, they drain into something known as dural sinuses, and these finally come out and drain into internal jugular. So internal jugular is this large vein which is formed here. It lies with the common carotid. So instead of common carotid, the vein is called internal jugular. And then we also have an external jugular, which is a more superficial vein. This internal jugular joins the subclavian vein. So subclavian vein is going back. So it will come all the way from the arm, from the upper limb, and we'll see that. And in the sense, it will be first, you'll have those radial and ulnar veins, and then you'll have a brachial and then axillary, and that will become subclavian. Subclavian joins the internal jugular to form the brachiocephalic vein. Remember, there's an artery also and a vein. You have brachiocephalic veins on both sides, but you have an artery, only one artery, okay? And then the two brachiocephalics join and they form the superior vena cava. So the two brachiocephalic veins join to form superior vena cava. We'll see it in the next picture. So this is the head and neck. And here we can see, the brachiocephalic, right brachiocephalic and left brachiocephalic. These two brachiocephalics join to form the superior vena cava. And here let's follow it from the palm. So here you have these digital veins. There's a venous arch also. Then we have radial and ulnar. And we have some superficial veins which we can see. If you look at your forearm, you can see some superficial veins. There is this basilic vein on the medial side and a vein called cephalic vein on the lateral side. But what's important is in between the two, in your cubital fossa, you see, and it's a little different in everyone. You see a vein joining these superficial veins. This vein is called the median cubital vein. This is the one where commonly intravenous blood samples are taken because it's so easily seen, easy to access that, people normally take blood samples from this area. So the deeper veins are the radial and ulnar. They join and then they form the brachial vein, which will become the axillary vein. And the axillary continues as the subclavian. The subclavian joins the internal jugular and forms brachiocephalic on either side. Brachiocephalic joins to form superior vena cava, which opens into the right atrium. So you can see how blood from the from the upper limb and blood from the head and neck have gone into the superior vena cava. Now here in the thoracic region, remember we said there was a little difference. You see these veins which are present, these intercostal veins. So they drain into something known as the azygous system. So it has three different veins, but we can just call it the azygous system. And notice how the azygous is connecting the superior and inferior vena cava. So these azygous veins actually finally drain into the superior vena cava. So even the thoracic region goes into the superior vena cava. Okay? Here I want you to notice the inferior vena cava. So we can see this. Remember, the inferior vena cava opened into the right atrium of the heart. So if I was to draw the heart here like this, so this is how it would be. So this would be the right atrium. Here is the right ventricle, and left atrium. So you can see both open into the right atrium. Let's now look at the inferior vena cava. So here's the inferior vena cava. So it's going up. So it will be formed by the two common iliac veins. They will join to form inferior vena cava. And each common iliac vein in turn will be formed by internal and external iliac vein, right? So you're going in a backward direction. Common iliac veins join and form inferior vena cava, which will pass up and open into the right atrium. Look at some of the tributaries of the inferior vena cava, or veins draining into the inferior vena cava. So you can see the suprarenal vein on this side, the two renal veins. These are the gonadal veins. There are some lumbar veins, okay? But here there are these veins called hepatic veins. But notice nothing over here from the GI tract, except hepatic, which is from the liver. But we'll see in the next picture how the GI tract doesn't go into the inferior vena cava directly. So you can see in this, the tributaries, the main tributaries of the inferior vena cava are, you can see the suprarenal vein on the right side, the renal veins on both sides, gonadal vein on the right side. You can see these lumbar veins. And there's a little difference in the gonadal on the left side, but you can ignore that. For all purposes, let's say gonadal and suprarenal going into the inferior vena cava finally, okay? This is the drainage of the GI tract. So hepatic portal system is the GI tract drainage. And if you remember, I said that from the gastrointestinal tract, all the nutrition was absorbed into the blood. So it goes into the veins. So the veins of the GI tract have deoxygenated blood, but it's nutrient rich. So you first want it to go to the liver so that the liver can remove all the nutrients, deal with whatever it has to do, metabolize them, and then it will send the deoxygenated blood now, devoid of nutrients, it will send it back into the inferior vena cava and then back into the right atrium. So let's look at this picture here. So here look at the stomach, the colon on either side. So these are all the veins which are draining the colon, the stomach, the spleen, okay? So here two big veins, the splenic vein, see the splenic vein and the superior mesenteric vein. So the splenic and the superior mesenteric vein, the two join together to form this portal vein, or also known as hepatic portal vein. So splenic and superior mesenteric join to form hepatic portal vein. So notice what splenic vein drains. Some of the gastric blood vessels drain into the splenic vein. You can see this inferior mesenteric is draining into the splenic vein. And here all of this part of the colon is draining into the superior mesenteric. So can you see that most of the GI tract is draining either into the splenic or superior mesenteric. And so finally it's going into this portal vein. Okay? Except you can see these gastric branches going directly into the portal vein, but don't be too concerned with that. So now this nutrient-rich blood is going into the liver. So notice it goes into the liver, where now this vein actually breaks up into small branches like an artery. So when it breaks up into these little branches, it gives off all its nutrients to the liver cells. And from those branches, they join up and form another set of veins, which finally form veins called hepatic veins. So this portal vein breaks up into small branches. So it breaks up into branches, which will form capillaries. Those will join and then finally form hepatic veins. And now the hepatic veins drain into the inferior vena cava. So here you can see the inferior vena cava. So you can see these hepatic veins draining into the inferior vena cava. So that's how blood reaches the liver, gives up its nutrients, and then the deoxygenated venous blood goes finally into inferior vena cava. Okay? So the purpose of this portal circulation is to carry nutrient-rich blood to the liver, so that the liver can first get it and do its job. In certain parts of the body, such as the lower end of the esophagus and in the anal canal, there are areas where there is an anastomosis between veins which drain the GI tract and veins which drain other parts of the body. So that is known as a portosystemic anastomosis. The part which drains the GI tract is the portal part. Systemic is, for example, lower end of the esophagus. The esophagus is drained by those azygous veins which drain into the vena cava. So that's the systemic part. So there are veins which, and let me use a blue color. So there is this site at the lower end of the esophagus. So we have veins which drain one part of the esophagus and they're going upwards like this. And we have these veins which drain the lower end of the esophagus. They are going here towards the portal vein, and this is going towards the vena cava. So at this point, the blood goes in opposite directions. Sometime if the portal vein was blocked, or maybe even the vena cava is blocked, what will happen? Blood tries to go this way, but it can't. So it kind of finds this anastomotic channel and it goes through here like this. So at this area, the veins get extremely engorged. Can you see that? So that's known as portosystemic anastomosis. You may have heard of it. In the anal canal, this is what are known as internal hemorrhoids. You've all heard of hemorrhoids, right? And in the esophagus, this is known as esophageal varices. Varices means worm-like because they're very, very tortuous and dilated. This is a dangerous situation because it's just below the mucosa and, it can be eroded. People with internal hemorrhoids tend to have bleeding when they pass feces, stools. So here also these people may have bleeding when they swallow something rough. It could tear the epithelium of the esophagus and they may vomit blood. Okay, so we are worried about this when portosystemic anastomosis sort of opens up. Cirrhosis of the liver is one such condition where this anastomosis opens up because here in the liver is damaged, so the portal vein cannot drain into the liver. Now, if you got a question like this, which of the following veins does not drain into the inferior vena cava? Yes, it's hepatic portal vein. The suprarenal veins, remember I told you for your purposes, the right one drains directly, the left goes into renal, which goes in. So let's take it that the left one also does. The portal vein does not drain into the IVC at all, okay? It drains into the liver, and then the hepatic veins drain into the IVC, okay? And here are clinical, so this is showing you a cirrhotic liver, and this is the esophageal varices. See, it's just below the mucosa, and you can see how swollen and tortuous. Any slight sort of abrasion can tear these veins up and produce massive bleeding. So let's look at the next circulation, which is fetal circulation.
That will form the embryo's heart. Heart begins to beat. These two. The heart. Here's a newborn heart on the left. Let's take a closer look. There's the right atrium, right ventricle, left atrium, and left ventricle. The two major blood vessels are the aorta and the pulmonary artery. The pathway of blood in a newborn heart works like this. Oxygen-poor blood from the body enters the right atrium, then goes to the right ventricle. From the right ventricle, the blood is pumped to the lungs, where it becomes oxygen-rich. Then, the blood flows back to the heart, filling the left atrium, and from there, on to the left ventricle. The left ventricle pumps the oxygen-rich blood through the aorta, which carries it to the rest of the newborn's body. You can see the fetal heart has the same basic components as the newborn heart, but there are a couple important differences. Because the placenta is providing all of the oxygen the fetus requires, its lungs are not needed to perform this task, and therefore, much of the fetus's blood is detoured away from the lungs through two openings or connections. They are the foramen ovale, which connects the right and left atria, and the ductus arteriosus, which connects the aorta and the pulmonary artery. As blood enters the heart into the right atrium, some of the blood flows into the right ventricle, as in the newborn. But also notice that some blood flows directly into the left atrium through the foramen ovale. This blood will pass directly into the left ventricle and be pumped out to the body without ever having gone to the lungs. In addition, some of the blood that did enter the right ventricle and would normally go to the lungs never reaches the lungs. Here, let's watch. As blood is being pumped out of the right ventricle towards the lungs through the pulmonary artery, some of that blood escapes into the aorta through the ductus arteriosus, bypassing the lungs as it does. These two important connections will remain open up until the time of birth. Within 30 minutes after the baby's first breath, the ductus arteriosus will completely close, and the flap of the foramen ovale will shut off like a valve. This happens because of an increase in pressure on the left side of the heart and a decrease on the right side. These changes in the heart anatomy cause the blood to flow to the lungs, which will take over their lifelong job of supplying oxygen to the body. It's incredible to think that this complex organ started off as a couple of tubes only 2.5 weeks ago.
So let's look at fetal circulation. So you saw how she said in that video that the lungs are not functional, so there's no point sending blood to the lungs, right? So you need to do something. The placenta is the one which acts as the lungs. So if you remember when we first looked at fetal circulation, I said again it has umbilical arteries and umbilical veins, and the role is reversed. Arteries carry deoxygenated, veins carry oxygenated blood, right? So let's look at this over here. So here we have umbilical arteries which arise from the internal iliac. So this is the internal iliac. And notice the color change. It's kind of little dark. So it's not totally deoxygenated. You know, the oxygen levels are low in this. So here are the umbilical arteries. So we'll say for all practical purposes deoxygenated, but you've got to understand that the oxygen level is much lower, not totally deoxygenated blood. These two umbilical arteries, they go to the placenta. So here they're going to the placenta. So in the placenta, there's exchange of blood and exchange of gases, not exchange of blood, exchange of gases. So this partially deoxygenated blood becomes oxygenated and it goes into the umbilical vein. So now notice the red color here. So the umbilical vein now is carrying oxygenated blood, okay? So because imagine this is the lungs. So remember in the lungs, the pulmonary arteries were carrying deoxygenated and the vein was carrying oxygenated. Same thing here. So umbilical vein is now carrying oxygenated blood and it comes here into the liver. Now as it's passing the liver, it meets the portal vein. Remember the portal vein, we just saw it was taking all its deoxygenated, nutrient-rich blood into the liver. So it meets the portal vein. Now if it joined up with the portal vein, what would happen? It also would go through the liver. So now the liver is going to get all of the oxygen. You don't want that to happen, right? So actually what it does, it bypasses, there's a little sort of tract which allows a portal vein to join the inferior vena cava. So since it joins two veins together, this is called ductus venosus. And here's the inferior vena cava. So here this umbilical vein joins the portal vein, but soon after it passes, instead of going with the portal vein, it joins this ductus venosus and goes into inferior vena cava. So can you see that and here is the inferior vena cava, see here, coming from below, right? Here's the inferior vena cava. Remember those hepatic veins which open into the inferior vena cava? So the inferior vena cava was carrying deoxygenated blood. Now the umbilical vein through this ductus venosus pours oxygenated blood into the inferior vena cava. So can you see how the inferior vena cava will therefore have mixed blood? It will have both oxygenated and deoxygenated. Can you see that the blood gets mixed here? And they actually seem to flow in two separate channels. Now this blood goes into the right atrium. So here in the right atrium we also have superior vena cava opening. So follow my cursor. So superior vena caval blood, which is bringing blood from the upper part of the body and the head and neck area. So this all deoxygenated, so you can see that's why in blue. This blood goes through the tricuspid, it goes into the right ventricle. This inferior vena cava blood, which has now become partly oxygenated because of this umbilical vein here, most of this blood goes through that foramen ovale, it goes into the left atrium. Some of it goes into the right ventricle. Can you see this? Some of it will go into the right ventricle. That's why this color change in the right ventricle. So here it was totally deoxygenated. In the right ventricle, you can see it is kind of mixed. In the left atrium, can you see it? Most of that oxygen, remember I said it goes in two streams. One stream is deoxygenated, one stream is oxygenated. So most of the oxygenated blood now goes into the left atrium, into the left ventricle, and goes into the aorta, and it will travel and supply the branches through the arch of aorta and through the coronary arteries. It will go there. Let's follow this one, which went from the right atrium. So it had totally deoxygenated, some of this oxygenated blood coming into the right ventricle. So that's why the color changed a little bit. This goes into the pulmonary artery. It has to go to the lungs, but the lungs are not functioning. So it travels through this ductus arteriosus, and now it mixes with the aortic blood. So since this was more deoxygenated than this one, can you see now that's why the rest of the aorta gets a little bit of that deoxygenated blood. The upper part till the arch of the aorta is all purely oxygenated, which is why in a fetus the head and brain grow much faster and better. That's why the head looks very big compared to the rest of the body, because it's getting more oxygenated blood. Now this comes down in the aorta through all its branches. It supplies, all the rest of the body, and then it gives off these umbilical arteries which go to the placenta. So that's why I said that, can you see that the umbilical arteries are not totally blue and shown in blue in color, because they do have oxygenation in them, just not to as much of a degree as we see up here. Can you see that? When the baby cries, what happens? As soon as it cries, the lungs expand, so they begin to function. So now the pulmonary veins will function. So the blood will go, instead of going from ductus arteriosus, it will go through into the pulmonary veins, into the pulmonary artery and lungs, and come back through pulmonary veins into the left atrium. So now left atrial pressure will increase, and it will close that foramen ovale. So there will no longer be that foramen ovale, and that's what you saw, that fossa ovalis, that is the remnant. Ductus arteriosus is no longer needed, so this also will close off and become what's called ligamentum arteriosum. And even this ductus venosus closes, because what happens? You tie off this part, right? The umbilical. So all these will fibrose, and this will also close off. So now let's see what happens in a newborn. So here's the newborn. So notice first that foramen ovale has closed. Okay, it has two leaflets. They are closed because of the increased pressure in the left atrium, since now pulmonary veins are bringing blood back into the left atrium. So it closes the flaps. The ductus arteriosus no longer exists, so it becomes ligamentum arteriosum. So here this is what is ligamentum arteriosum here. And even the ductus venosus will close, and also the umbilical arteries and veins. So now we get the fully four-chambered heart that we saw in, that we have and which a newborn baby has, okay? Sometimes the foramen ovale may not close, or the ductus arteriosus may not close, in which case you get congenital problems. You've heard of people with a hole in the heart, which is a septal defect, which is the foramen ovale is open, or they may have something up here where the interventricular septum also may have a defect, or they may have something called patent ductus arteriosus, where the ductus arteriosus has not closed. So what happens is that blood goes from here into the aorta, and so, it keeps sort of mixing like that, okay? So any questions on this?